I'm a medical doctor, and I have been in Mbali since 1999, working with the Deliverance Church there. We have two medical facilities. One is a village clinic where we concentrate on antenatal care, safe deliveries and looking after babies, including immunising them. Of course, we also see anyone else that comes through the door. We also have what we originally called Joy Hospice, but we now think we should change it to Joy Health Centre and Hospice in Mbali town. I do have a second job now that started in 2010, in that I'm an ordained minister in the Church of Uganda. I often preach, I take a communion service. We went to a village once that had not even had a communion service for 4 years because the local vicar who ran the parish did not have enough money to buy a bottle of communion wine and to buy the wafers. We always are very eager for people to pray for us, that we will work together as a team, that the work will go forward. Of course, I'm now 67. And although retirement is not in my Bible, one has to be aware that one's not necessarily going to be healthy, for so many more years. So prayers please about succession. We have attempted to do this over very many years and have not really succeeded. It would be great if there was a doctor who could come out, and even greater if there was an administrator who could help tie up the administration side of things. We also have one particular need at the moment, and that is for a vaccine refrigerator in the health centre in Mbali town. Unfortunately, this has to be a specialist refrigerator that is able to work, for example, from electricity and bottled gas, because our electricity supply is very uncertain and often goes off 2 or 3 times every day, and sometimes of course it can go off in the middle of the night. So this means that the vaccine refrigerator, which is taxed by the government as it enters the country, instead of costing about £500 because it's dual fuel, it's more likely to cost £3,000. Now, to be a level 3 unit and get a little bit more help from the government, we have to be able to immunise children. I know it sounds a little bit illogical when we specialise in palliative care, but nevertheless we need a vaccine refrigerator so that we can immunise the children, having already opened a maternity unit in the town, and we've started to do deliveries. But we can't immunise the children yet.